Hello, I'm Dr. Fred Venditti. I am the hospital general director here at Albany Medical Center Hospital and the executive vice president for system care delivery. I'm joined today by Dr. Vincent Verdile, the dean of Albany Medical College. Welcome, Vince.
Thank you, Fred.
We're giving you the update today from Albany Medical Center. Dr. McKenna is enjoying a well-deserved vacation this week. Let's start with the COVID numbers. Let's pop up the first graph here. You can see that in the region, we continue to hover, Vince, somewhere around 100 inpatients. Literally now going back to March 5th. We've been in that range plus or minus 5 or 8 cases. On the regional call this morning, there's a little tick up, but not much in terms of those hospitalized within that broader region that's represented by the call. Let's pop up the second graph. This is the admissions and discharges. And you can see we're kind of in balance, a few admissions a day and a few discharges. So let's pop up the third graph, and this is our census, and today we're at 26 inpatients here at the medical center. 15 of them are on med-surg floors, 11 are in the ICU, and 5 are ventilated. And Vince and I were talking just before we came in about those on the ventilator. Many of them have been here a long time, right, Vince?
It's a good sign. There's a lot of people that are in the ICU but not ventilated.
That's right. I think the last time we put someone on a ventilator was on March 28th, so just about a week ago. So we continue to admit people, but they're not as sick.
Not as ill. That's a good sign.
That's really good. Let's talk a little bit about vaccines. We don't have the numbers for the capital region, but last week we were well over 350,000, and there are many more vaccines that have been administered since then.
The pop-ups and rollouts are growing.
And and our workforce has done a tremendous job in terms of administering vaccines in our different sites, but also in getting vaccines. So it's very, very important, particularly as we start to see some of the variants that are a little more infectious. We heard some information about that.
Yes, some very interesting data from Wadsworth. So our random screening of our patients and our employees, samples that went to Wadsworth are picking up 4 variants primarily. The UK variant, 2 California variants, and 1 New York City variant. If you look back through the first quarter of this year, in the month of December, there were no variants detected in random sampling. The month of January, 4% of samples had one of those 4 variants. By February, it jumped to 19%, and in March, 40% of the samples randomly taken over at Wadsworth through genomic profiling are coming up one of those 4 variants. So it could be foreboding.
It absolutely, and it's important to tie the variants to the vaccine. So all of those variants have a higher transmission rate. They're more infectious. And so it's very important that we really get the people vaccinated, both in the community and in workforces in the hospital, as we've done here in other hospitals, to try to prevent that transmission.
Absolutely. In the meantime, vigilance, masking, distancing, hand washing until we have herd immunity.
All the things that we've been talking about right along, literally for more than a year now, are very important to continue.
Absolutely.
So we'll continue to track this. It's been a great partnership with Wadsworth. This is very useful information for all of us.
Very much so.
So I said that Vince is the dean of the medical college. We thought we'd take a little opportunity this afternoon to talk a little bit about the college and some of the things going on.
I'm always happy to talk about the college.
I know you are.
So spring is very busy in the college. Really the kickoff of the spring season is Match Day. This is where our students, after finishing their 4 years of undergraduate medical education, find out where they're going to do their sort of finishing school, their residency training in their subspecialty or specialty or subspecialty areas. So I'm happy to say that all of our students matched in extremely well, very prestigious places all around the country. About 37% of them stayed in the state of New York, which is very good for the state of New York. And about 14% of them stayed right here at the Albany Medical Center Hospital, which I think reflects very positively on their educational experience here, that they felt confident enough to do their remaining training here.
That's great.
46% starting their training in primary care. Now that's an incredibly high number of students, which I think speaks very well to their experiences in family medicine, internal medicine, pediatrics, and those primary care disciplines. The top 5 choices for our students: internal medicine, pediatrics, anesthesia, obstetrics, emergency medicine, and surgery share number 4 position, and then lastly, orthopedic surgery. So our residents, again, matched extremely well, and I'm happy that many of them are staying here at the Albany Medical Center Hospital to continue their training.
So, you know, Vince, they'll be graduating in a couple of months.
Yes.
So commencement's going to be virtual again this year, right?
Yes.
But there's a pretty exciting speaker who's going to be speaking at commencement.
So unfortunately, commencement's going to be virtual because of where we are in the midst
Yeah.
of the pandemic still. We'll be graduating physicians, as we just mentioned, nurse anesthesiologists, physician's assistants, bioethicists, and then basic scientists who'll go on and continue to do research. Carl June is our commencement speaker. Dr. June was the 2018 Albany Medical Center Prize in Medicine recipient. Since then, he's won many other prestigious awards. He's at the Perelman School of Medicine in Philadelphia in the Department of Pathology and Laboratory Medicine. His research, and this is a gentleman with over 500 peer-reviewed publications, has been on gene-modified T cells. He initially was studying that in the context of patients with HIV/AIDS, and then moved into patients with severe leukemias. And he was using a chimeric antigen receptor, CAR, C-A-R, T cell treatments for these patients. In 2014, the FDA awarded breakthrough therapy, since the outcomes and the outcome of those patients treated with CAR T cells was very, very impressive. And we're doing some CAR T here.
We are, and I think, you know, we've talked about CAR T before on this video. Basically, it means taking some stem cells from someone with leukemia or some lymphomas now, inserting a new gene in so that they recognize the cancer cells, and that's done in a laboratory in California or someplace. Those cells are amplified, and then they're sent back and infused into the patient, and they become the cells that attack the cancer and eliminate the cancer. Very, very high success rate.
It harnesses your own immune system to do the work.
And so that's been going on in a couple of trials here at the medical center with our partners NYOH. So really exciting.
Very exciting. Looking forward to hearing him talk.
And so then, Vince, once they graduate, they become alums, right?
Exactly.
And Alumni Weekend is usually in the spring as well.
So the other exciting part about the spring is reunion weekend. So unfortunately in 2020 we had to cancel it because it was supposed to be in April in the midst of the peak of the pandemic. This year we're going to have an all virtual reunion weekend. So the classes of 70 and 71 will be celebrating their 50th anniversary, which is always exciting. We have a distinguished alumna, Ursula Matulonis, class of 1987. She's the chief of gynecologic oncology at the Dana-Farber. She'll be presenting this Friday her distinguished alumnus lecture, and we're looking forward to that. And unfortunately, we can't do in-person gatherings at this time, but hopefully we will schedule something in the fall so that we can gather with our alumni here on campus.
You know, Vince, the medical college is such an important institution for this region. Again, this is something that I think we've talked about before. You know, somewhere in the neighborhood of half of the physicians who practice here in the capital region either went to medical school here or did their training in one of our training programs, internship, residency, and fellowship. Be a very different place medically if it weren't for the college.
Very much so.
Yeah. Very important.
Yeah, very much so. And we've been able to, by virtue of the college and the kind of care we offer at the hospital, to recruit the kind of specialty and subspecialty physicians that this community so desperately needs.
Yeah, absolutely. So let's finish with something off the intranet. It's about our translation service. You know, I knew we had a translation service. It's very robust, but I was reminded just before we start that it actually provides translation for over 150 languages.
Incredible.
Isn't that amazing?
Yeah, it's incredible.
They use an iPad. It's available 24/7. You know, probably the dominant language that we're translating is Spanish,
yeah.
Probably Spanish, but literally 150 different languages, including sign language, can be used to better communicate with our patients. Just as we're communicating through this video, communication is very important, particularly when you're sick and we're trying to make you better, trying to understand what's going on and convey information to you. So shout out to those that are involved in the translation service. Well, I think that'll do it.
That should do it.
Thank you for joining me today. As always, we'd like to say take care of yourself and take care of each other here from Albany Medical Center. We'll see you on Thursday.
Be well.